This one right here is hot.
This is your jacket. Oh.
My name is Kiran Jenkins, and I'm the owner of KXJ Apparel. I create everything myself. Print it out on my cutter machine and heat press it. The FTM line came about because me, myself, I am FTM. I am female to male transgender. I wanted to create a conversation and empower guys like me to be able to just be authentically who they are. I had surgery with Dr. Kuhn at Johns Hopkins, and I just feel like I'm able to basically get back into the normalcy of my life.
My name is Devin O'Brien Kuhn. I'm Chief Medical Director of the Johns Hopkins Center for Transgender Health. Gender affirming surgery ultimately is to improve the patient's happiness and quality of life. It's a matter of understanding the patient's goals and being able to figure out the surgery that for them in particular will achieve those goals.
My mom, she used to sew a lot around me. She was very creative, and that was always an interest of mine. I would say at that time I was a mama's girl. Like, we were best friends. I was a cheerleader. I didn't like always wearing the dresses and the clothes and things like that, but it was a sport and it made me happy. At 24, I transitioned from female to male because once I started to really do the research, I'm like, wow, this is me. Like, this just sums up my life and what I want. I was recommended to a surgeon in Washington, D.C. for my phalloplasty surgery. So that's basically when they create the phallus, the male genitalia. So, so I went in for surgeries and it was completely botched. We later found out that he had never undergone phalloplasty. It was kind of something he was jumping into. I was basically his first patient, and he just left me with a bunch of scar tissue. I went through a huge depression. I was just like, I'm never gonna be able to be myself again. But then after that, I was like, yo, like, what do I have to do to get this fixed?
I remember the first time I met Kiran, he was down at the time because the initial surgery had gone so poorly. I think we were able to restore that confidence relatively early, that we had done this even in people with worse outcomes than him.
They definitely made my confidence boost. So I just knew that this was the right journey to take, the next step.
I've had patients who've had 12 or 15 prior operations that we've been able to fix and get to where they want to be. While that's never a guarantee in a revision procedure, it also means there's at least some reason for hope.
Well, when I woke up after I had undergone the surgery with Dr. Kuhn, he did this thing when I was there with the Doppler, and basically they place it on the implant and they hear a heartbeat, like I hear like blood rushing through the phallus itself. And I just was through the roof. If I could have jumped out the bed and ran up and down the hallways because I was so excited. Like, being able to hear that and hear like a strong blood flow was like the best feeling in the world.
Revision patients almost always feel like they're stuck in limbo, but once they see that the finish line is in sight, their entire attitude towards life changes.
I'm able to just wake up, look at myself, see the person that I am, and I'm comfortable and I'm happy and I'm just normal. Like, everything is just freedom.